So I am a member of the, Health Management Associates, the backbone organization for the Healthy Women, Healthy Baby Zone grant program sponsored by the Division of Public Health. We work directly with the grantees who are receiving the awards to provide technical assistance and support to the grantees throughout this program. They are all working to improve birth outcomes and have been awarded grants since 2020. And so we're entering our fourth cycle this fall, and they're wrapping up their third cycle this spring. And so this afternoon in the breakout session, you get an opportunity just to hear from a few more of the organizations that are doing great work to improve birth outcomes in Delaware. Again, so I'm going to give you a little bit of a brief update on what the group has been up to, what kind of outcomes they're looking at, and then we'll hear directly from those organizations about what they're doing. And then we'll invite you all to ask questions, and we're going to invite our grantees who spoke at the previous breakout to report out as well. So just to jump in, again, this is we're just wrapping up our third cycle, and all 8 of our grantees this cycle were able to impact over 550 participants in their programs. And these are actionable community-based interventions really working towards improving birth outcomes throughout the state. And so they're working to impact things like mental health, looking at stress, depression, and wellness. They're impacting physical health, providing and supporting healthy lifestyle choices, providing financial stability for their participants, helping to improve fatherhood, fatherhood involvement and family dynamics, assessing and impacting social networking, and then, of course, impacting longer-term health outcomes as well. And so this is a brief snapshot of what our grantees who are going to present in this session are up to, and we'll be hearing from Black Mothers in Power, the Delaware Coalition Against Domestic Violence, the Delaware Multicultural and Civic Organization, or DEMCO, and HAAD, or the Hispanic American Association of Delaware, this afternoon. And so without further ado, we're going to jump right in. And I said this in our last session, and I'll say it again, you all have 4 minutes, our grantees. But if you could come in at 2 to 3 minutes just to give us a little bit more time for questions and discussion at the end, that would be great. And the first grantee that I'm going to invite up is, do I see Erin's here? So we're going to invite her up to talk about the Delaware Coalition Against Domestic Violence. And I see you've unmuted yourself, and I'll get you started now.
Thank you. Yes, hi everyone. My name is Erin Rideout, and I'm with the Delaware Coalition Against Domestic Violence. I'm here to talk about our collaborative and innovative public health approach to domestic violence. Domestic violence can lead to complex health, safety, and social needs for the 1 in 4 who experience it. Here in Delaware, the number of adults who experience physical violence, sexual violence, and/or stalking by an intimate partner in their lifetime would fill the capacity of the Dover International Speedway 2 times. Acknowledging the high prevalence of domestic violence, it is also important to recognize the disparate impact of domestic violence on women of color. The Domestic Violence Community Health Worker Program provides safety planning, care coordination, and financial support to Black and Hispanic women who are pregnant, newly parenting, and of reproductive age in New Castle County. The services are accessible. The Domestic Violence Community Health Workers meet women in the community wherever they feel safe and comfortable and provide services in both English and Spanish. Additionally, the Domestic Violence Community Health Workers use flex funds to meet the urgent and tangible needs of survivors and their children. With the support of the Healthy Women, Healthy Baby mini grant and other generous funders, the Domestic Violence Community Health Workers have provided over $135,000 in support to date. The most common areas of need are housing, basic needs, children's needs, physical health, and transportation. The Domestic Violence Community Health Workers build long-term, trusting relationships with survivors, and these relationships serve as the foundation for the positive impacts of the program. Survivors stay engaged with their Domestic Violence Community Health Worker for an average of 10 months. We hear from survivors all the different ways that the Domestic Violence Community Health Workers have changed and in some cases saved their lives. The data supports what these survivors are saying. Survivors engaged with the domestic violence community health workers report 1 week fewer poor mental health days and 1 weekend fewer poor physical health days than before when they started working with their DVCHW. In addition to the health impact, our data also shows an improvement in quality of life, decreased financial stress, and increased hope for the future. DCADV is always seeking to connect with healthcare teams to ensure patients get referred to the domestic violence community health workers. Healthcare providers are often first responders for domestic violence survivors and have a really unique opportunity to make this potentially life-saving connection. DCADV offers free trauma-informed training and resources to strengthen healthcare teams' screening and referral practices around domestic violence. We're also seeking funding to support the expansion of these services to Kent and Sussex counties. I'd love to talk with anyone further about this work. It's my favorite thing to talk about. So please do not hesitate to reach out to me with any questions or requests. Thank you.
Thank you so much, Erin. And we'll circle back with any questions. The next grantee, and I just want to encourage you all, if you have any questions as you're listening to these grantees talk about their incredible work, please feel free to enter them in the chat or the Q&A portion of the chat on the right, and we'll circle back to that after all the grantees are presented. The next organization that we'll bring up is DEMCO, and we have Ms. Leandra, who is going to be sharing for that organization. Are you able to unmute yourself?
It looks like you need to connect your audio.
Okay, Ms. Leandra, we'll give you a second to get that unmuted, and then we'll jump to another grantee and then pop back here. How about that? So Shanae, are you still with us? You mind popping on to talk to us about Black Mothers Empower?
Oh, hello?
Yep, we got you, Ms. Leandra. We'll circle back to you.
Okay. Okay.
Go ahead, Shanae.
Oh, okay. Well, good afternoon, everyone. My name is Shanae Darby. I am the founder and executive director for Black Mothers Empower. Black Mothers Empower, we are focused on Black women, Black families, Black babies, and trying to contribute to the conversation throughout the state and reducing the infant mortality rate and morbidity rates, and also the rates for a Black woman. So I believe we are the only Black-led organization being funded through the DHMIC. We are also, we're being funded to run the Doula Training program. So the Doula Training program falls under our community programming. We also have a postpartum program where we work with Black women in a postpartum stage. And we also work with the Wilmington Housing Authority to provide doula services. But specifically for the doula program that we have, we trained 10 Black women to become a doula. 8 of those 10 became certified. Each person who became certified served between 3 to 6 people throughout the program to become certified. They met twice a month. They did monthly book discussions that were focused on reproductive justice, Black maternal health care, equity, and having those conversations together to build community. They also had monthly workshops where they focused on specific topics. So it might be like bereavement or breastfeeding or anything, abortions and miscarriage, focusing on different types of conversations that doulas would need to kind of, be able to support birthing people in. So with being able to serve the community that we serve, we also collected demographic information, which we're still collecting on who's being served by Black Mothers Empower doulas. So the work that we're doing for the community-based doula training program, they get trained to be a full spectrum doula. So that means they work with mothers or birthing people during pregnancy, birth, and in the postpartum stage. So our doulas are trained to do to work with moms throughout the whole full spectrum of giving birth and that afterbirth piece. We're really focused on community awareness. I keep hearing like a noise or someone else talking, so it's really distracting. But we are also focused on doing work around community awareness. So focusing on celebrating Black Maternal Health Care Week, Black Baby Wearing Week, Black Cough Diaper Week, World Doula Week. So focusing on trying to highlight the voices of Black women, because one thing that we do know is that Black women, we have the solutions. We know what we need to do to address the disparities. I still hear the sound. I don't know if anyone else hears it, but someone, like, it's a background sound and they keep making noise. But I don't know if anyone is unmuted. But yeah, so it's like distracting for me. But so we are focused on highlighting Black women's voices. We're really big on intersectionality. So even with our doula training program, we wanted to have a diverse group of Black women who had different backgrounds and experiences, because Black women, we're very different. We're not a monolith, right? So making sure that in our doula cohorts that we're embracing intersectionality and what it means to be a Black woman, what it means to be a Black birthing person in the state of Delaware. We're also focused on community organizing. So when we say that, we're talking about legislation. So working closely with like State Representative Melissa Minor Brown in regards to like legislations to increase access to doulas, to make doulas more affordable. And we're also working with her on a whole bunch of other legislations around reproductive and maternal care. Also, Black Mothers in Power, we have working groups. About 2 years ago, we reached out to Medicaid and said, hey, I reached out to Medicaid. I said, hey, I want to get a group of doulas together and kind of talk about what it looks like to start a pilot program for a doula program. So that's when, that's how I bring community-based doulas to that conversation to talk about what Medicaid reimbursement would look like for doula services. And we're also looking to work with the hospitals and local universities on developing programs to work with doulas and to support doula work. So that's like Black Mothers in Power. To sum it up, our program, the work that we do, and yeah, that's all I have.
Thank you, Shanae. And then again, we'll circle back if folks have more questions or want to know more about your organization. Ms. Leandra, are you able to unmute us this time and give us a little bit of information about DEMCO? And sorry about that feedback, Shanae. I'm not sure what was going on there. Most folks seemed to be muted. I hope it wasn't me. Ms. Leandra, are you able to unmute and join us?
Yes, I'm sorry for this technical difficulty here. But we're DEMCO, Delaware Multicultural and Civic Organization. We're excited about being a part of this beautiful event. And we are we're funded, our WIT program and MID program is funded by Healthy Women and Healthy Babies. And again, we're excited to be here. So we're going to say just a few words about DEMCO. First of all, in the and just a glance, a highlight, some highlights about DEMCO, and then we will go specifically into talking about health, the part that deals directly with healthy women, healthy babies. DEMCO is a nonprofit organization where we are 25 years old. We have, for example, we have been awarded the 2021 State of Delaware Best Nonprofit for Community Outreach, and also in 2020, the State of Delaware Best Nonprofit for Multicultural. We received that award as well. DEMCO has been a nonprofit organization whose goals have been to heighten and promote educational, economic, and social stability through the prevention of tutorial services, academic programming, social and economic development. And we work in all 3 counties and primarily in Kent County. We serve an unusually high number of residents. And in fact, the University of Delaware did an independent study on us from 2015 to 2018, where we served 9,420 Delawareans. So we do impact a lot of persons with all of our programming. We're known for creative and innovative programming. We just have a lot of various programs that we do because we work with school districts and any other organizations that would, that are like-minded in terms of and have the same goals that we have. We do work with them. And so we have a lot of partners up and down the state. So just to give you some example of some of our programs, we have a cultural health ambassadors project. We have books and basketball where we use evidence-based programs such as Atlas and Athena. We have robotics, as well as we do after-school programs. After-school programs are currently at Eastover Elementary School. We also have them at Central Middle School. We've also partnered and worked with Delaware State University and just several universities to continue to, do these various projects. At CMS in Eastover, we're currently doing the Young Entrepreneurship and Young Authors program. We have an incentive program that fosters financial literacy. And to just give you an example of some of the components that we address in our after-school programs, will be reading prevention. We do bullying, suicide, alcoholism, all the substance abuse prevention. We do that as well. And then whatever elective that the particular principal would like. And we've been doing this through our Demco Academy again for 25 years and focusing on these various components with a lot of community service, back to school programs, all of those things to stay engaged in the community. Now, particularly with our WIT and MIT program, we have Dr. Linda Hackett, who is our Senior Vice President. She's going to talk more about that particular program and share some of the highlights of those programs. Thank you.
Okay, good afternoon. I'm Dr. Hackett, and I'm one of the co-founders of Demco Inc. And I've been in education for over 40 years. And what I have found out is that we just don't have a racism problem, but we also have a social economic situation. And that means we have more things to do together than apart. In other words, Demco also knows that strong families is equal to strong communities. So that's why we were so happy to get funded with the Healthy Women, Healthy Babies, because that gave us a way to really help our young women. Mrs. Marshall talked about working with the schools. In the schools, we were able to deal with the high school children, and we're still able to use some of the high school aged girls and guys in this WIT-MIT program, we call it. And what we are trying to do is to enlighten them to financial literacy and also to be that pipeline of all of the adversities that they will come upon while they're matriculating into being fathers and mothers. So in our WIT program, we're able to help our clients with the things that they need, like clothing, along with the educational piece, which allows them to get an IC3 certification. But we help them with clothing. We help them with interview skills. We help them to know how to fill out an application online. We deal with the total family. The other unique thing is that with Town Point Elementary, the counselor gave us a list of names of mothers that wanted to be in the WIT program, the IT program. Along with that, they got bi-weekly $50 gift certificate out of the flex funds. Their children were also able to get free tutorials, which is very powerful. And we send a journal, also a bi-weekly journal, into the home. We wanted to reach the entire home because we know that's what gives that support for any parent or young lady that finds themselves pregnant or feeling the devastation of not knowing what to do. So we want to try to give comfort. The other thing we're doing is to help them the wraparound service, like purchase of care, gas, utility bills, all kinds of things that will help them feel more at ease, because we know that mental health is an issue. And the gentleman who was talking this morning saw how a person's support group, he talked about the police and all that type of thing. We're out here trying to educate and be with our clients and be with the homes and working with the schools. We work with the schools, the churches, boys and girls clubs, all up and down the state of Delaware, because we know that that's what it takes, a cohesive unit to look at the total person. I'm old enough to have seen parents, their children, and their grandparents. And I know that things are dealing with the zip codes, the rural parts of our state, as well as the inner cities. So that's probably our time up. Good, but I could go on.
Thank you, Dr. Hackett. Thank you, Ms. Leandra. I'm going to take us to our last person. I know we could talk about our programs and our work all day, but I want to make sure that we have time for at least a couple of questions. So Dr. Ronaldo, do you want to come on and tell us about HAAD? Are you able to unmute? Uh-oh, still muted. It should be a microphone at the center of, at the bottom of your screen.
If you're not seeing a microphone in the bottom, that means your audio is not connected.
So as you all can see, these organizations are doing some great work throughout the state of Delaware, a lot of disparate programming, but really the ultimate goal is impacting birth outcomes, impacting families and communities, and really meeting them where they are. Dr. Ronaldo, I saw you go on mute. Are you with us?
You did just have it. I saw you go on mute. I think it's trying to determine where your audio is coming from. It might be an issue with your headphones.
There we go.
Oh.
Okay.
Uh-huh.
I'm sorry. It said that I needed to be unmuted by moderator. Is this too high? The sound?
No,
Sounds good to me.
You can hear me well.
Mm-hmm.
Okay. My name is Ola. Ola. That's not my name. I just want to say Ola to everybody. Ronaldo Tello. I just hear a lot of, like, everything they say is said back to me. Can you hear that, or do you hear me well?
We hear a little bit of an echo. I think it might be.
Do you want me to try to wear my headphones? I don't know if it's too bad. Okay, is that?
Can't hear you at all now. It's because of the microphone that you have set up and linked to the platform. So you'll need to unplug your headphones. You're still muted. I'm not sure if you still have the headphones plugged in, but those will need to be unplugged.
Yeah, can you hear me now?
Yes.
Okay, let me go quickly through this. I'm a bilingual licensed therapist and with a PhD in mental health counseling. The Hispanic American Association of Delaware provides pregnancy and postpartum support in Spanish to women ages 15 to 44 who live in zip code 19720 and other low-income zip codes in Newcastle County. The support group meets twice weekly during pregnancy and postpartum, and even later. We've seen a lot of moms coming when the kids are toddlers, and even later. To reduce cultural stigma around mental health in the Latino population, provide support to families with recent migration and acculturative stress or acculturation stress, and offer referrals to insurance and other needed services. We also have individual sessions with participants, which allowed us to identify social determinants of health impacting the mothers so we can provide resource linkage, which is very important among women who don't speak English. As you can imagine, they have a hard time navigating the system. The program hosts also family network events to involve the whole family, especially fathers, to connect the community to pregnancy and postpartum mental health resources. So the program is called Mamás Felices, Hijos Felices, Happy Mothers, Happy Children, and had the goals of creating wellness, resilience, hope, and connection to women adjusting to parenthood and experiencing pregnancy and postpartum emotional ups and downs. One important goal or objective we also have, and we have been measuring, is to reduce stress, anxiety, and depression symptoms. As you can imagine, this influences a lot the general health and the birth and maternal outcomes. In cycle 1, 30 participants took the DAS 21 is a questionnaire that help us measure the level of stress, um, depression, and anxiety. The mean number of yes responses was 3.1 at pre and 1.6 at post. The decrease was statistically significant. In cycle 2, 45 participants took the DAS 21 at both pre and post. The mean number of yes responses was 10.31 and at pre and 9.75 at post. This change was statistically significant. And it's interesting that the second one was during COVID, the difficult moments of COVID. And of course, we noticed a higher level of depression, anxiety, and stress during those times. Now we are, looking into really expanding this to even physical health, because a lot of the mothers are saying that they don't have a lot of physical activity. Many of them live in, the inner city places where they don't really have parks or opportunities to go outside or to be active. So we are hoping to include that. We have seen situations where we realize how important it is to have bilingual and bicultural people providing services because they feel better at participating with that. My time is done, so I hope that gave you an idea of what we are doing in the Hispanic American Association of Delaware.
Sorry, Dr. Ronaldo, and thank you for sharing. I just recognize that we're in a little bit of crunch here just because of our technical difficulties and this very limited amount of time that we had to share all of your amazing work. Rep Minor Brown said that she does this work because she can and because she has a platform. And so I just want to commend all of you for really using your platform to do this great work to improve birth outcomes throughout the state, and with the support of the DHMIC and the Division of Public Health. And you'll continue to do that beyond this grant. So I want to thank you all for taking the time to share your amazing work in this panel and the previous panel at 11:30. I am excited to continue working with all of you. And I know I'm one of the newer members of the team, but this is one of the joys of working with the organization, to be able to work with community-based organizations that are doing great work like you all. And so I hope that the folks in the room were able to kind of capture these names and organizations that are doing this good work. Please reach out to them with your questions, with opportunities to support the work that they're doing. And hopefully there are more opportunities to actually network and really engage these groups going forward. Chrissy, I know that we have a little bit of room in the schedule here. I think we have a break. So I don't know if we want to take some questions, we want to give people the space. What are the rules here?
We do have a break, but if anyone has any questions, feel free to put them in the chat. And if not, then we'll give you your much deserved break.
Now let's see if I can find the chat.
Doesn't look like anything's there yet. Just give anyone a minute. But doesn't look like there's any questions. So I think we're good to jump to the break. Thank you, everyone.
Awesome. Thank you so much. And thank you, grantees, for dealing with the technical difficulties. Have a great rest of the afternoon, everyone.